years. And 84% of the people in France are satisfied with the quality of their health care. Life expectancy, 81 years. Even with that high satisfaction rate and long lifespan, some in France now believe their universal health care system is in need of change. Brooke Baldwin has our report.
Imagine a healthcare system where 99% of the population is covered. There's no hassle in seeing your doctor of choice, and the majority of patients are satisfied with the quality of care. France, a nation of more than 60 million people, provides basic universal health insurance. Most of the funding stems from a payroll tax, but employees do pay a small percentage. But unlike traditional single-payer systems, Michael Tanner with the Cato Institute says France is different.
It is a system that relies heavily on consumer cost sharing and market forces to control healthcare costs.
According to the Commonwealth Fund, a nonpartisan research group, only 33% of the French say their system needs fundamental changes, compared to 46% in the U.S. They have a higher doctor-to-patient ratio, and the French live longer. However, the French are starting to pay more out-of-pocket costs. Some shell out up to 40% of the cost of drugs and treatments in co-payments, and healthcare now consumes 11% of GDP, second only to the United States. France, like the U.S., is coping with rising drug costs, an aging population, and expensive medical technology. The result? Rationing of care, according to free market advocate Tanner.
They have put in place, for example, gatekeepers, much like managed care in the United States, where you have to see a primary care physician before you can see a specialist. You have to get approval to see certain types of specialists.
Tanner says the French are starting to complain about access to care and rising costs, complaints familiar here in the United States. One other criticism of France's healthcare system, this coming from Victor Rodwin. He's a professor of health policy and management at NYU. He says easy access to specialty services and rising costs of technologies, of pharmaceuticals, could make this system, Lou, unsustainable.
But right now, France topping out in Europe as the best of the public health care systems and the highest satisfaction rate. So thanks so much, Brooke.
Yeah,
appreciate it. Brooke Baldwin.